Thank you, everyone. You may be seated. Good afternoon, and welcome St. Petersburg College faculty, staff, guests, family, and graduates. The St. Petersburg College Nurses Association is proud to present this pinning ceremony in honor of the RN graduating class of May 8, 2014. I would first like to thank everyone for joining us today. My name is Ashley Brown, and I have the honor of serving as the SNA president. Graduates, it's been a long journey, and you've taken the first step in pursuing your dreams to become compassionate and empathetic nurses, while at the same time securing a career with infinite possibilities. Let us take a trip down memory lane in your adventures of the unexpected journey of a nursing student. In level 1, you came into nursing school bright-eyed and bushy-tailed, full of excitement, wearing your new clean white polo shirt. Your hygiene was maintained, hair and makeup done, and toenails were trimmed. You had adequate nutrition for your body requirements, decreased stress, and a readiness to learn. Then came the deer in headlights look when you realized, for lecture today, I will do nothing more than read this 80-slide PowerPoint word for word and enunciate that every point will be on the exam. Good luck studying. By the end of your level 1 clinical rotation, your olfactory senses were scarred for life from C. diff, gangrene, and oh my gosh, I don't even know what the diagnosis of that smell is. Onward, nursing students, to level 2, where you are introduced to pharmacology and OB while still practicing med-surg. By this semester, your clean white polo shirts have stains under the armpits from stress sweat, along with coffee and mustard stains to match. You have bags under your eyes, and you wish your instructor would prescribe some of those meds to you that you're learning about. Calcium channel blocker would be nice to decrease your heart rate and blood pressure, because you are sure that the pump pushing the precious prime precisely through the pipes is going to give out on you. Instead, you substitute with the legal stimulant coffee in the morning and wine to vasodilate in the evening. Your socks have holes in them from your 9-inch long toenails, and you're lucky if you brush your hair in the morning, let alone your teeth. However, you made it through the storms of level 2 nursing because you realize, I don't have to get A's, I just have to pass. In level 3, you felt like you finally had a chance to catch your breath. Your own childhood memories came back to life as you journeyed through Erickson's developmental stages, not realizing how much you yourself were developing into a nurse. By level 4, you were ready to taste victory. The only things standing in your way were 4 tests, 1 final, about half a dozen ATIs, an EOP, sim charts, and some written assignments that did not count towards your grade, to name just a few. You fought the good fight and you won. Not only have you won your degree, but you won over the hearts, admiration, and respect from all of those around you. Together, you have poured out your blood, sweat, and tears each semester. Truth be told, nursing school is a humbling experience, for you have learned to rely on each other, and no one person can do it alone. I personally have had the privilege of taking this journey with you, and I am so proud of each and every one of you, my family, my friends. All of you are good nurses. How do I know, you ask? It's not by your test scores, not by ATIs, nor IPAs, nor sim charts. It's by your hearts that are so full of love, which make you the kind, caring, compassionate people that I and your family have grown to love, admire, and respect. Use the wisdom of the knowledge you have gained in nursing school. Follow your gut, do not doubt yourself, and show your patients your heart. For by doing so, you will impact many lives for the greater good. How do I know, you ask? Because I am honored to say that I am a life that has been changed by you. Congratulations, my brothers and my sisters. I would like to make a few introductions and acknowledgments before we get started. I would like to introduce our Health Education Center Provost, Dr. Nicotera, our Associate Provost, Dr. Nancy Kelly, the Dean of our nursing program, Dr. Susan Baker, and I must acknowledge our nursing program director, Ms. Allison Chen, because she is very helpful to us as students. Students are so fortunate to have these administrators by their side, to have an exceptional nursing program, and to help them be successful leaders. Thank you. Will the current Nurses Association officers please stand? And let's give them one big round of applause because they work. Thank you for your commitment and time. Will the Student Nurse Association faculty advisors please stand? Our Student Nursing Advisor, Ms. Joanne Goot, and the Chair of the Student Affairs Committee, Mr. Jacob Schwab. Thank you guys for all that you do. Graduates, the obstacles that you have overcome were the intensity of your classes. No matter how tough the courses got, there was always a helping hand. Your peers, study groups, lectures by your dedicated instructors, and NIPS help you to make it to this moment here today. I would like to take this time to thank the faculty and staff. Class projects, intense discussions, and constructive criticism have given you all practical experience that you will guide in your future accomplishments. Your faculty instructors have devoted many hours of their time, experience, and leadership over the years. Thank you all. Family, friends, and loved ones. These students would not be here without your support, love, and encouragement throughout the nursing program. So please give yourself a big round of applause. We have a professional photographer here with us this afternoon who will be taking pictures of each graduate being pinned and will also be available for pictures following the ceremony. Now I would like to welcome our Dean of Nursing, Dr. Susan Baker.
Good afternoon. This is probably one of the most exciting parts of my job. I so look forward to this day. Let me start by congratulating all of you on this wonderful achievement. You have reached an incredible milestone in your life, and you should be so proud of your accomplishments. So start by giving yourselves a hand. I know that this has been a long journey, and you probably thought you'd never get here, but you persevered. You showed tenacity, and here you are. Let me also start to thank those people who helped you get here. Though we've acknowledged our family and friends, I think that you should give special gratitude to those folks who let you cry on their shoulder, who quizzed you with flashcards, who let you borrow money so you could go to Burger King or Subway for meals, and who, all in all, helped you get to this place. So let's give them another round of applause, family members and friends. So you've done a lot of hard work, and now this is the fruit of your labor. But let me remind you that to whom much is given, much is required. So you have been given a great gift. You're about to enter in one of the most beloved professions in the world. We are nurses not because we make a lot of money, not because we get a lot of prestige, but because we care about people. We care about the vulnerable. We care about those who can't do for themselves. We stand for those who can't stand for themselves, and we speak for those who have no voice. And that is the heart of what nursing is. So I hope that in addition to all the things that you've learned about how to give injections, how to put down NG tubes, and how to put in Foley catheters, and how to calculate medications, that you've also seen the compassion and the care and the dedication and the passion in our faculty. I'm probably a little biased, but I think we have the best nursing faculty that exists anywhere around. So as you've traveled down what I will call the yellow brick road, you have dodged flying monkeys of clinical preps and summative evaluations and formative evaluations and medication administration day, and you've dodged the wicked witch, and Glinda the good witch has given you a little few tips along the way, and now you are ready to collect your wand and your ruby red slippers. Now, what are your ruby red slippers, you ask? It's the passing of the NCLEX exam on the first take, which I know you will all do. So I just want you to know how very proud of you we are. We encourage you to continue your education or continue on your job journey. Come back to us and let us know how you've done. I encourage you to, as you start this leg of your nursing journey, find yourself a mentor, someone who can be positive, someone who doesn't believe in the eat your young mentality, and we as nurses don't adhere to that at all. And find yourself someone who's going to motivate you, encourage you, model the right behaviors for you. As you leave our sheltered walls and enter the world of nursing, you'll learn that there are people who will use a lot of shortcuts to get things done. That is not the St. Petersburg College of Nursing way. So we want you also to be models for those people you might encounter. Know that you're not going to always have positive days, but on the days that things don't go as well as you hoped, know that when you know you've done the best that you can do and you've given everything you have, then you can sleep well at night and know that you've done a good job. And at the end of the day, that's all we can hope for. So I am so proud of you. I encourage you to continue and do good things. Continue to hold St. Petersburg College of Nursing in good stead and represent us well, as I hope we've done you. Again, congratulations and enjoy this time.
Thank you, Dr. Baker. Now I would like to introduce our guest speaker, Dr. Nicholas Gramato. Dr. Gramato graduated in 1976 from Adelphi University with a bachelor's degree in biology and received his DMD in 1980 from the University of Florida College of Dentistry in Gainesville, Florida. Dr. Gramato spent 15 years in private practice before returning to academia. He received a master's degree in material sciences and engineering in 1992 from UF College of Engineering and a master's degree in oral microbiology in 1995 from UF College of Medicine. Dr. Gramato has taught at UF College of Dentistry since 1989 and became a tenured faculty member in 1999. He has served UF as Director of Quality Assurance for its dental clinics, Director for Advanced Techniques with Aesthetic Restorations, and Director of Infection Control in Dentistry. In 2007, Dr. Gramato completed a doctoral degree in Educational Administration and Policy at UF College of Education. In addition to teaching and developing coursework on treatment planning and clinical dentistry, Dr. Gramato teaches continuing education courses for healthcare professionals on professional ethics and other current medico-legal topics. He is owner of OSHA Compliance Training Associates and consults with medical and dental offices on OSHA and HIPAA issues. Dr. Gramato is a legal healthcare consultant, completing the certification course in 2012 from Stony Brook University School of Law. He has lectured nationally and internationally on risk management, record keeping and compliance, ethics and jurisprudence, treatment planning, and other practice-related topics. Dr. Gramato developed most of the curriculum for the online Bachelor's of Applied Science and Healthcare Administration at St. Petersburg College and taught for 2 years in that program. He was academic chair of natural science at the Seminole campus and E-campus for 2 years and taught anatomy and physiology and other departmental courses. The most important thing in his life is family, and especially his 2 grandchildren, Callie Camille, who is 3.5 years old, and Evan Joseph, who is 5 months old. They have taught him what books, certifications, and degrees cannot, and that is unconditional love. Please welcome Dr. Nicholas Gramato.
Thank you for having me. I didn't realize I did all those things. But one part, before I get to my official talk, I'd like to say I am a dentist. So I think this is historic today because I think this may be the first time that you've ever had a dental person or a dentist speak at a nurse pinning ceremony. There are a few life-altering experiences that a person will have throughout their lifetime. Your pinning ceremony is one of these. The pinning ceremony has been a part of nursing school graduation celebrations since the 1860s, though the rite has been seen way back in the 12th century. I'm sure the nurses and the students can tell me more about the specifics of the actual ceremony, but again, as I said, today is historic because it's the first time that we have a dentist giving a talk. Over the course of your formal training, Ashley spoke about this, and so did Dean Baker, but you've read hundreds of pages, you've cut and pasted the same 10 medication side effects hundreds of times. You've reviewed so many journal articles and have written so many papers that you probably can rattle off APA format to me right off the top of your head. You've performed hundreds of hours of clinicals, so you can assess your patient, and you can even assess complete strangers at the mall. You can also take vital signs, change wound dressings. I mean, I have a big list, but a lot of this Ashley went through. But you've had the opportunity to practice these skills over many hours, many weeks, many months, and soon you're going to be doing these on a daily basis. From my perspective, I see this ceremony as serving 2 purposes. On one hand, you're congratulating yourselves for making it through this long and arduous curriculum and clinicals successfully. And on the other hand, you're being recognized for this and your accomplishments. And as you go on to become graduate nurses, you're also taking on a great responsibility. The pin is the reminder of this responsibility, because from now on, you're no longer mere citizens, but a breed of superhero called nurses. People will seek your opinion for advice, refer to your knowledge for answers, look at your actions for guidance, and most of all, trust your expertise with their lives. Maybe we should give a cape instead of a pin. But how do you handle these pressures? I'm going to just give you a couple of things. What you need to know is that it's more important what you don't know, because when we come upon that, we need to be aware of those things because we don't want to make a mistake and step across the line where knowledge ends and ego begins. So if we don't know something, we need to look that up. For me to stand up here and say that you must become a lifelong learner, I think you can tell by what Ashley read to you. I definitely am a lifelong learner. I've been going to school for many years, but there was a reason for that, and that's what all of you have to become, lifelong learners. You need to love your work, and that's great, but you need to love your life, which is better. You must find a balance between life and work, and you must find the things in life that give you joy and spend time doing those, because balance is important. When you find yourself struggling to like someone, whether it be a patient, coworker, employer, remember, that person may be having one of the worst days of their life, especially when we're dealing with sick patients. That may be the worst point in their life. So think about how you would want to be judged think about one of the worst times in your life and how you might have acted that way. So remember that when you're dealing with people. And then really, every day, your goal should be to be better than the day before, to learn more, to teach something, to be kind, to be generous. Being better is often difficult to do. The best decisions you ever make are the ones that turn your stomach with anxiety as you make them. Each and every one of you has it within you to do amazing things, so go out and do them. Be better and strive to be the best that you can. I want to talk a little bit now about some things. I heard Ashley say care, concern, compassion, and she said most of the class had that. I've done multiple studies concerning patients and why they keep going to the same physician, or why they keep going back to the same dentist, or why they go to a specific health facility. And those were the terms that came up. The staff, the physician, the dentist had care. They were caring, they had concern, and they had compassion. And listening to what Ashley said, it sounds like most of you have that already, and I think you will be great successes. But I think if we look at the 2010 Healthcare Reform Act, it has a big long name, but we all refer to it as Obamacare, okay? So let's get that out of the way. But there are some things that come under there, and there's some responsibilities, and there's a lot of opportunity for you as nurses. I think you must, there's about 8 things that I want to just point out quickly because I don't want to take too much time, but you must use nurse-led innovation. Nurses know how to expand access to care and improve the quality at an affordable cost. Nurses have developed innovative care models in the past, and in the literature you can see many of these models. So we need you and other nurses to keep developing these innovations and come up with new ways of patient care. Second, you need to generate evidence and engage in research. Every day when you're treating patients, you're coming across data. We don't have to do research that's written down and do specific research, but see what treatments work best for your patients, and how patients are more satisfied with certain things, and how we treat them. So that's very important, and I think for the rest of us, the parents, the relatives, we need to rally and help get funding sources to support these nurses and to support for them to do research, because they are dealing with patients on a daily basis. We must also redesign nursing education. SPC has one of the best programs, but all nurses need to possess basic competencies to meet the demands of an aging and diverse society, with an emphasis on clinical training in multiple settings across the lifespan. The emphasis should be on quality and safety, evidence-based practice, research, and leadership. Certification and continuous learning opportunities are essential to a profession that's responsible for others' lives. We must also diversify the workforce. My last line was to say that we need to get more males in nursing, but when I look out there, there's a good amount of males, and that's very important, because over the years that's what's been said, because there has been a need for more males. But approximately 33% of our population belongs to a racial or ethnic minority group, and by the year 2042, minorities will account for a majority of the U.S. population. So to reduce health disparities, greater effort must be made to ensure that the nursing workforce reflects the patient's diverse backgrounds and cultural values. And we need to become culturally competent when we treat patients. I'm sure you've had courses on that, but you need to realize that every patient comes to us with a different background, and there's different things that certain cultures don't look you in the eye. And that's not because they're not listening to you, that's just the way that their cultural background is. We also need to embrace technology. I know SPC has done a great job with that, because you have all the best simulators, but you also need to look at this in your where you work, and you need to become a person who is involved in making some of those decisions as to what new technology works and what should be implemented. We also need to foster interprofessional collaboration. Teamwork is critical. I said I'm a dentist, but I feel that it is the healthcare team. On the healthcare team is the physician, the dentist, the nurse. We can go through all the auxiliaries and all the other people that are involved. But always remember that the patient is the most important part of that group. And we must develop leadership at every level. Nurses should have the opportunity to take on leadership activities, whether they practice at the bedside or sit in a boardroom. They must believe that they are capable and fully empowered to provide excellent care and make the changes necessary to improve ineffectual systems. Physicians and administrators must support nurses. Most of all, nurses need to help each other. And Dr. Baker said something about that. As far as mentoring and finding a mentor, you need to help each other out with all different aspects. And lastly, you need to be at the table. As the healthcare professionals most actively engaged in direct patient care, nurses are positioned to provide leadership in all healthcare areas. Among these are developing systems to reduce medical errors, improving quality, providing better care coordination, increasing the access to care, and averting workforce shortages. Clinical experience isn't enough. To serve as successful and knowledgeable board or committee members, nurses must become familiar with governance, strategy, fundraising, financial systems, health law, and policy. And always, always say yes when you're asked to be a part of a decision-making team wherever you end up working. I'd like to end by saying, at the end of her life, Florence Nightingale said, "May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard practical work, the difficulties, and the joys of organizing nursing reforms, and who will lead far beyond anything we have done." Please take her words to heart and prepare yourself to contribute to the reforms that will take place in your lifetime. You all have so much to contribute. Go out there and take your profession to the next and highest level that you can. Please, each one of you, be one of the leaders that Florence Nightingale was referring to. I congratulate all of you, and we will have a test on this in a few minutes. Thank you.
Thank you, Dr. Gramato. You guys ready? You've been waiting long enough. The pinning ceremony is a time-honored nursing school tradition dating back before the turn of the 20th century. Traditionally, nursing students have conducted a pinning ceremony to mark the passage from the student nurse role into the professional practice role. The student nurses are being pinned by their clinical instructor as a way of symbolizing the welcoming of the student into the profession as colleagues. The yellow rose symbolizes life. The beauty of the rose is perfection, and the thorns represent the difficulties overcome to reach perfection. This rose also symbolizes knowledge, and the buds represent the students as their knowledge is just the beginning. The yellow rose also symbolizes honor and loyalty to the profession, as well as joy and gladness. Graduate nurses, always wear your school pin with pride. Let it serve as a constant reminder not only to yourselves, but also to your patients and your desire, perseverance, and dedication you have made to serve others. May I please request the presence of Dr. Baker to the podium to begin the pinning. Faculty, please prepare to pin your students.
Mrs. Rhonda Anderson's clinical group. Leo Gruyan. Vanessa Dumont. Andriana Tassopoulos. Sarah Grimes. Vicki Russell. Rebecca Grinnell. Chloe Johnston. Got it. Alkeita Halila. No way, huh? I remember. Dylan Maybe. Mary White. Mrs. Diana Burgess's clinical group. Robert Leiby. Heather Rebick. Oh, yeah. Ashley Miller. Lauren Peacock. Krista Garabrandt. Got it. Ladan Rohani. Rebecca Fawcett. Diane Tierney. Karen Descent. Mrs. Lori Davila's clinical group. Brandy Adams. Amanda Wickett. Michaela Coffin. Megan Hopkins. Kirsten Virus. Nicole Mastakia Sousa. Lisa Mitchell. Jennifer Chenoweth. Erica Moore. Dr. Susan Hartrant's clinical group. Lindsay Ailes. Is that D? Joshua D. Barnes. Danielle Buchanan. Eliza B. Jackson. Christy Williams. Megan Kopp. I got it. Lindsay Mergenthaler. Susan Asper.
Sunil Prasad.
Sunil Prasad. Leslie K. Scheller. Mrs. Jacqueline Hawkins Johnson's clinical group. Hathorn. Travis Hathorn. Miranda Andes. Amanda Wheat. Margaret Schumacher. Bonnie Camp. Stephen Gaudet. Stephanie Duffy. Tiffany McDonald. Mary Rabetti. Ria Alejandro. Anisha Jobanputra. Mrs. Pat J's clinical group. Elias Kazala. George Cross II. David Reyes. Grace Murphy. Mark Nielsen. Renee Rose. Carol Blackwood Young. Kristen Prado. Allison Forbes. Yes. Andrea. Andrea Stallworth. Clifford Williams. Mrs. Becky Keeney's clinical group. Lacey Ann Downs. Kinsler. Okay. Tom Kinsler. Delana Woods. Holly Vanneman. Christina Parker. Jennifer Rome. Shear. Pamela Moore Shear. Mrs. Deborah Lauman's clinical group. Kaylin Pham. Cochran? Okay. Karen Cochran. Tracy Bulmer Hobley. Courtenay Baker. Lauren Stark. Joanne Kelly. Tahisha Coleman. Alicia Waiters. Mrs. Jennifer Mastretta's clinical group. Jessica Cassidy. Are you related to the other? Oh, that is so cool. Sylvia Waiters. David Ryan Kobisk. Veronica Bishop. Daphne Izagiri. Marcia Marquez. Ms. Jackie Murdoch's clinical group. That's right. Adam Carroll. Natalie Goff. Carly Iton. Vanessa Keys. Nicole Perhack. Carrie Armendinger. Nicole Carney. Nisi D'Amatos. Marella Hadzik. Tina Poole Williams. Stefan Trosch. Mrs. Christina Patterson's clinical group. Tammy Phillips. Amber LaValle. Denise Gazorski. Chelsea Kruger. Okay. Yulia Hashlafi. Megan Golovkin. Lisa Butler. Natalie Bell. Oh. Mrs. Felicia Pryby's clinical group. Katie Adams. Karen Desatnik. Like the bridge. Jacqueline Franklin. Brianna Hernandez. Lindsay Richardson. Sarah Roby. Margaret Powell. Aaron Woodward. Yeah, I think I got it. Ray York. Mrs. Marty Ratliff's clinical group. Andrew Moen. Ashley Favero. Marissa Pitts. Dottie Manuzak. Suzanne Petroselli. Amy Smith. Eve Graham. Maria Lovera. Dennis Charkuski. Janet Lou Allen. I'm assuming it's Ruth, okay, got it. Nicholas Ruth. Joshua Scarborough. Mr. Mark Rupp's clinical group. Ivana Beck. Rosie Dom. Renee Dunning. Donnie? Danny? Liam? Liam? Okay. Danny Leam. Yvonne Campanella. Yep, that one's easy. Corey Hill. Baltron Lee. Got it. Lucinda Elio. Stevenson. Chris Stevenson. Jonathan Zabo. Mrs. Virginia Snyder's clinical group. Brittany Body. Raquel Anderson. Stephanie McGlashan. Emily Powell. Nadia McNaught. Deborah Mobsby. Tamara Coffin. Amanda Ortiz. Oh my goodness. Lindaja Mary Jonga. Lindsay McQuinn. Mrs. Helen Sharp's clinical group. Janice M. Collins. Is that a J? Okay. April J. Bogar. Vonda Haygood. Yeah. Amanda May. It is Hazel, right? Okay. Carrie Hazel.
Ulysses. Yes.
Got it. Ulysses, Canada. Kristen Bailey. Molly Heron. Janelle Storis. Christina Lazaridis. Mrs. Marla Sutton's clinical group. Diana Webb.
Kara Giorgio, Magali.
Magali Kara Giorgio. Adriana? Adriana. Adriana Leschinska. Sherry Love. Holly Black. Tracy Butner. Nancy Bosch. Frank Conlon. Mitch Lusignan. Easy. Craig Irvin. Ms. Ruth Velasquez's clinical group. Yep. Lori Paul. Stephen Anthony Reno. Derek Anthony Baltimore. Tierra Pangonis. Ganiyat Tiamiyu. Carla Constantine Smith. Elizabeth Mayers. Paula Miller. Angel Swerbinsky. Laura Steinsdorfer. Ladies and gentlemen, I present the May 2014 St. Petersburg College of Nursing Associate Degree graduates.
Graduates, please remain standing. Family and friends, go ahead and grab your seat for just a little longer. Oh, I know, I'm sorry. Graduates, please recite with me the Florence Nightingale Pledge. I solemnly pledge myself before God and in the presence of this assembly to faithfully practice my profession of nursing. I will do all in my power to make and maintain the highest standards and practices of my profession. I will hold in all confidence all personal matters committed to my keeping in the practice of my calling. I will assist the physician in their work and will devote myself to the welfare of my patients, my family, and my community. I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and welfare of the community. I will constantly endeavor to increase my knowledge and skills in nursing and to use them wisely. I will zealously seek to nurse those who are ill, wherever they may be and whenever they are in need. I will be active in assisting others in safeguarding and promoting the health and happiness of mankind. Thank you. You may be seated. I would like to take this opportunity to remember the friends and family who could not finish this journey with us. To all of those we have lost along the way, in honor of their memory, let us offer this moment of silence. In closing, on behalf of the Student Nurses Association, I'd like to congratulate once again the graduating seniors of May of 2014. Following this program's conclusion, there will be refreshments in the Fellowship Center. There will be ushers to escort you. Graduates, please remain behind momentarily for the group picture. Family and faculty, if you'll please quickly clear the middle section so the graduates can gather there. Make sure there's no empty seats in between you guys. And this concludes our pinning ceremony. Thank you all once again, and congratulations, you guys.